So I'm sitting here with Sophie Janssens, Global Head of Patient Impact Maximization at UCB. And I want to mainly touch upon one big topic here at the EPA Conference, and that's all about integrated evidence generation, or strategic evidence generation planning, however we call it. But maybe you can first quickly introduce yourself, and especially also UCB and your role, because indeed it changed and it has a very mystical but impressive name. So.
Okay, so I'm Sophie Janssens. I'm for 15 years in UCB. Before that, I started on government side, and I've been in consulting firms supporting pharmaceutical companies. UCB is a mid-sized biopharma company that focuses on neurology and immunology conditions mainly. We have some other ones, but that's the core. And we have a mix of large competing drugs in dermatology versus more specialized, rare drugs as well, which is an interesting balance of the portfolio. Who am I? I am since 15 years there, and I've always been in what you could call pure access and pricing roles or expanded access and evidence roles, because that's what I'm passionate about, right? I'm passionate about bringing the right evidence, first of all, making sure that we're bringing differentiating drugs to market, and also helping the company to say no to some drugs that are in development. And from there on, really thinking of evidence in an integrated fashion in order to really be able to have a value package that convinces the regulator, but also the payers and also the healthcare practitioners, which means that what is cross-functional stakeholder on the outside also needs to be reflected on the inside, right? So we very often have a siloed way of looking at this, and so this is really my mission. My roles have been market access and pricing, real-world evidence, and I was in charge of the early development programs to bring that end-in-mind thinking integrated, and now I'm back into the commercial organization supporting with our many launches of our drugs.
Yeah, and that will be very busy times, I think, for you.
Yes. First, last year alone we had over 100 launches. And I'm talking product, not even SKUs or anything. So it's a little bit like a global operations organization reporting
but
into.
A bit different, what I understood from your presentation.
It is different, right? You can kind of call as the enabler, the pivoting table that connects global to local from an execution perspective. So we have launch readiness folks working together with the supply, working together with our pricing operations in my team and the governance. All the content, management, clearance and operations sits in our team.
But that sounds quite traditional still.
Yeah, so that's the traditional part. What's the non-traditional part is that we have in the execution also support on ISEC. But the more important piece is the upstream part.
ISEC? Just for
integrated strategic evidence generation. Okay, so to say it easy, and that's with most companies the same. Clinical development plans stay separate from the ISEC plan, so that's all non-clinical and non-core safety studies for the regulatory approval. But they are very connected, right? The integrated evidence gives input into the clinical development plan, and large post-marketing studies also are picked up in the ISEC plan.
Okay, so this is the place where it all comes together.
Yes.
Okay, cool.
Yeah, they're looked at together as the full evidence package. The more different part of this PIM organization is that global operations is usually global to local. There's a big part of what we do that
one
is really
directional. You mean? Yeah.
It's the upstream piece that's super important, right? So in our team, for very early on, we're already looking at what is the right evidence that we need, even in the exploratory with the early development team. So we're working with them. Then we go in confirmatory, and what our team does is really collect on a continuous basis the country evidence need in a disease for an asset, and they are a key part at the negotiation table to vet which studies are going to happen.
And I really like that part, because that was the striking part, at least for me. Your presentation is usually integrated, is only across the functions integrated. But I think what you guys make the difference is really integrate the countries from the start. So but is that not a bit of a challenge in the sense of the multitude of markets? How do you manage that? Because it's like with functions, it's like medical, access, regulatory. You integrate 3 functions, but now you have to integrate,
so many countries.
Yeah, exactly, The
way that we look at it is pretty simple. So we're always talking to the cross-functional customer tables in the countries. That's really important. And of course, we start with the large countries. We start with US, the obvious one, the EU5, Japan. We're looking at China after. So we're looking at the key ones, the G7, as we can call. And then based on that, we're having a sequence of countries that we go through to really sanity check. We run them through, right? My team still goes to those countries and collects the needs, which is much more pressure testing. Have we missed something?
Yeah, it's
is
more
the US the right one?
and not fully
is there
bottom
something
up again.
specific to your country that we need to take into account? So that's what we do.
Yeah, and it becomes a little bit of a leaner process for the second and third tier markets.
Yeah, because obviously you get a whole load of questions and then you need to prioritize them according to the impact framework.
All right. And maybe also a thought that I had is like, if with the EUHA regulation, the joint clinical assessment coming in place, everybody also here on the conference, PICO everywhere. This is also about early PICO predictions. How does that fit into your framework?
I think it speaks for itself, right? The fact that we're already doing this early on makes us able to already inject into the joint clinical assessment. What you need to know is, because our team is already starting to support the plans that are still in development. So this is the first time that we're going to go to the joint clinical assessment. The country integrated evidence needs are taken into account so that we can have a joint clinical JCA
so I can imagine in that respect where a lot of companies need to do a kind of a PICO simulation, PICO surveys that's already done in UCB through your model, which is... but that's excellent. Maybe to close, what do you see as the three takeaways from the presentation you had today? What were your key messages to the audience? I know them, but it's also maybe good to hear them from you.
The key messages for me is make sure that you always have the country perspective, because otherwise you bring evidence to the countries that they can't need. Be purposeful when you collect evidence and you bring it to the markets. What we often see is that too many messages are derived from that, and too many messages for our clinicians, to be honest, and also for our payers. Of course, there are different messages. They need different elements. It's not useful. They drown in that, right? So they need to be able to put in their mind when they see a patient in 15 minutes, half an hour.
They
in
just
some
need to know one or two key things.
They really need to know what is going to inform their decision in the best possible way. So don't drown them. That's I think. And the third piece for me is make sure that the cross-functionality and the integrated thinking, the customer table in the countries also really works well from an evidence generation perspective. Really integrated.
Because I can imagine that last part might be new for the country perspective. Thanks. But I really liked your element of that fit for purpose. That stuck with me, because what I used to see, especially when people start generating evidence, the risk is like, once we're at it, let's also ask this and this and this and this. And the more you ask, the more data points you have, and then you're almost struggle in the end probably to get out the most relevant messages. But it's maybe a kind of fear of missing out that you have to reason from the other way indeed, from what do the stakeholders need, and only focus on that. But
you could see that the third kick-out question for our impact framework is, do we need it for internal decision making or not? Pharmaceutical people want to continue to find stuff out, right? So often we're satisfying our own need for knowledge.
Exactly.
We need to be careful with that.
Yeah, because we're a commercial company trying to bring products to the market and not a research company. Perfect. Thanks, Sophie. It was very inspiring.
Thank you.